President.
The senator from Maine.
Thank you, Mr. President. Mr. President, I would ask unanimous consent that the senator from Minnesota, Senator Klobuchar, and I be permitted to speak as if in morning business.
Without objection.
Thank you, Mr. President. Mr. President, Alzheimer's is a terrible disease that exacts a tremendous personal and economic toll on the individual, the family, and society. In addition to the human suffering it causes, Alzheimer's costs the United States an estimated $226 billion a year, including $153 billion from the Medicare and Medicaid programs. These costs will only skyrocket as the baby boomer generation ages. Already our nation's costliest disease, Alzheimer's, is projected to cost more than $1.1 trillion if nothing is done to change its current trajectory. It is now estimated, Mr. President, that nearly 1 in 2 of the baby boomers reaching age 85 will develop Alzheimer's. As a consequence, chances are that members of the baby boomer generation will either be spending their golden years suffering with Alzheimer's or caring for someone who has it. In many ways, Alzheimer's has become the defining disease of this generation. And if we are to prevent Alzheimer's from becoming the defining disease of the next generation, it is imperative that we dramatically increase our investment in Alzheimer's research. At a time when the United States is spending some $226 billion a year caring for Alzheimer's patients, we are spending less than 0.3% of that amount, under $600 million a year on research. This makes no sense, Mr. President. We currently spend $4.5 billion a year for cancer research, $3 billion a year for research on HIV/AIDS, and $2 billion a year for cardiovascular research, all investments that have paid dividends. Surely we can do more for Alzheimer's, given the tremendous human and economic price of this devastating disease. Mr. President, investments in research for other diseases have yielded tremendous results. We see that with cancer, with HIV/AIDS. Patients have access to new treatments, and death rates for some of these diseases are decreasing. At the same time, mortality due to Alzheimer's is escalating. Alzheimer's is one of our nation's leading causes of death, with recent data revealing that each year more than 500,000 deaths are attributable to Alzheimer's and other dementias, 6 times the amount previously estimated. Moreover, Alzheimer's is the only one of our nation's top 10 deadliest diseases without an effective means of prevention, treatment, or a cure. Fortunately, there is promising research that holds hope for Alzheimer's patients and their families. The research community is poised to make important advances through clinical trials and by investigating new therapeutic targets. But adequate funding is critical to achieve this promise. The national plan to address Alzheimer's disease was authorized by the bipartisan National Alzheimer's Project Act, which I co-authored with then-Senator Evan Bayh. The national plan has as its primary goal to prevent and effectively treat Alzheimer's disease by the year 2025. The chairman of the advisory council that was created by the act, Dr. Ronald Peterson of the Mayo Clinic, has testified before Congress that the United States should be devoting $2 billion a year at a minimum to Alzheimer's research in order to reach that goal. Mr. President, a dramatic increase in funding for Alzheimer's research will not just save lives, it will also save money. According to a report issued by the Alzheimer's Association last year, a federal investment of $2 billion a year between now and the year 2025, as recommended by the experts on the Alzheimer's Advisory Council and the scientific community more broadly, would be recouped within the first 3 years after a treatment delaying the onset of Alzheimer's by just 5 years becomes available. I am therefore pleased to be introducing today with my colleagues, Senator Klobuchar, Senator Mikulski, Senator Warner, Senator Durbin, and Senator Stabenow, a resolution declaring that the goal of preventing and effectively treating Alzheimer's is an urgent national priority. In recognition of the fact that bold action and considerable increases in funding are necessary to meet that goal, our resolution states that the Senate will strive to double the amount of funding that the United States spends on Alzheimer's research in fiscal year 2016, and that we will develop a plan to meet the target of $2 billion over the next 5 years. Mr. President, our bill is supported by a number of organizations, including the Alzheimer's Association, USA Against Alzheimer's, the Leaders Engaged on Alzheimer's Disease, or the LEAD Coalition, and the Alzheimer's Foundation of America. I would ask unanimous consent that the letters from these organizations be included in the record.
Without objection.
Mr. President, we have to face the facts that if we do not invest in Alzheimer's research at the levels that the experts tell us is necessary to develop effective treatments for this disease, perhaps a means of prevention or eventually a cure, this disease is going to continue to cause untold suffering, not only for its victims, but for its families, and it will bankrupt America's healthcare system. I urge our colleagues to join us as co-sponsors, and I want in particular to recognize my partner in this effort, the senator from Minnesota, Senator Klobuchar. The home of the Mayo Clinic is in her state, and she has been stalwart in supporting the efforts to increase funding for Alzheimer's research. With that, Mr. President, I'm very pleased to yield to my partner, Senator Klobuchar.